Of course, when we talk about the Syrian refugee crisis, now we understand why people fled in the millions in Syria, why you have half of the population displaced. You cannot have a refugee crisis in that scale without extreme brutality that was deployed mostly by the regime, and then of course the ISIS and other groups, but mostly by the regime against its own population. No one puts their children in a boat unless the water is safer than the land, according to Warshan Shire, which is a Somali poet in England. All of you are familiar with the picture of Aylan Kurdi, the child who drowned in the Mediterranean. All of you are familiar with the thousands of Syrians and others, of course, who are still fleeing Syria, seeking safety and better future for them and their children in Europe. Aylan Kurdi, that's probably one of the moments that you had most American kind of got to know what's going on in Syria, and you had a surge of sympathy to the Syrian refugees because he looks like our children. You know, he looks like our children. This unfortunate child drowned in the Mediterranean. There are about 5,000 at least Syrians who drowned in the Mediterranean Sea trying to flee to safety in Europe. Most of the people who are displaced in Syria are still inside Syria, 6.5 million or so. And you have large number of refugees, about 5.5 million, as I mentioned. Most of them are in Turkey, which has 3.5 million, Jordan about 600,000, Lebanon about 1 million, Iraq 250,000, in Egypt and other countries. And Europe, of course, had a good share of Syrian refugees, especially Germany and Sweden. The largest country that has Syrian refugees, or the country that has the largest number of Syrian refugees, is Turkey, followed by Lebanon. 1 out of 5 people in Lebanon is a Syrian refugee, followed by Jordan. You have also a large number of Syrian refugees, 250,000 in Iraq. You have about 100,000 in Egypt. And the largest country in Europe or in the rest of the world is Germany, in terms of having a large number of Syrian refugees. Germany has about 600,000 Syrian refugees. This is the share of the United States and Canada. Who are the Syrian refugees? In general, most Syrian refugees are middle class, coming from urban areas, some coming from less urbanized area, but the majority come from urban areas. Mostly are now living in urban centers, we call them non-camped, but you have also large refugee camps, especially in Jordan. This is Al-Zatari camp. At one point, it was the 5th largest city in Jordan. The peak of the crisis had about 170,000 refugees. Now it has about probably 60,000 refugees, Syrian refugees. You had camps in Turkey, Iraq, and Lebanon. Of course, the difference between the Syrian refugees and other refugees, that Syrian refugees are very close to Europe. So it only requires them to cross part of the Mediterranean to reach Europe, Greece or Cyprus or other countries, Italy or Spain, or they can cross Turkey to Eastern Europe. They're educated in general. The languages that they speak are Arabic and Kurdish. They settled in more than 160 countries. So you have a huge influx of Syrian refugees to every country that you know. Mostly are Sunni Muslims, but also you have other religions. But because the victims are mostly Sunni Muslims, so most of the Syrian refugees are Sunni Muslims. Most of them speak Arabic, Arabs and Kurds, also another minority in Syria that fled. So they speak Kurdish. 75% are women and children. They have high expectations in general for their children and for their life. Women play a major role in the Syrian family. In general, Syrians are entrepreneurs. They're business oriented. They want to build their own future. They're organized, resourceful, and support. There's a well-organized and resourceful Syrian diaspora, and they're easy to integrate, and they are very resilient. Many of them are in the younger groups. When asked about why they left Syria, the majority said that because of the imminent threat to their life. And they hold the Assad regime responsible for the fighting, others ISIS or Free Syrian Army, but the majority blame the president. And the majority still want to go back to Syria, according to Berlin Social Science Center data in 2014. The only way that they go to Syria if the war is to stop, or Bashar Assad to leave. And these are the two conditions that most Syrian refugees will tell you if to go back to Syria. ISIS has to leave the country. There is no more ISIS in the country. Democracy and free and fair elections is another reason. At the peak of the crisis, Syrian refugees, displaced Syrians, wanted to have a no-fly zone to stop the barrel bombs. That did not happen. It will not happen. They wanted safety, basically. They wanted to live without the fear of being killed by barrel bombs or chemical weapons. They demanded stopping any arms delivery to Syria. That did not happen because Russia and China continue to support the Assad regime. And also they needed humanitarian aid. Of course, we had a large number of Syrian refugees going to Europe through Greece, and this is Lesbos Island. You have here a group of Syrians who just arrived and they're leaving to mainland. Tariq ila Almania, the road to Germany. I saw that in the hand of one of the Syrian refugees in Greece, and describe what kind of transportation modality that you need to take from Syria until you reach Germany, and how much it'll cost, $2,400. The world response to the Syrian crisis was different. German Chancellor Angela Merkel was the best, I would say, world leader in terms of embracing Syrian refugees. At the peak of the crisis, when you had thousands of Syrian refugees coming to Germany every day, she said that we can manage, we're schaffen das, and that became very famous word in Germany. President Trump, the first thing that he did when he took office in 2017, that he enacted the Muslim ban or the travel ban that did not allow Syrian refugees to be resettled in the United States. These are the numbers of Syrian refugees who resettled in the United States, starting from 2012-13. The peak was in 2016, about 15,000. And then 2017, and then you had the travel ban, and since then you have very minimal number of Syrian refugees resettled. And this year, less than 100 Syrian refugees were resettled. And these are the cities that most of the Syrian refugees were resettled. As I mentioned, less than 100 Syrian refugees were resettled in the US in 2020. Even the peak number of total refugees was lowered to 18,000 in 2020. Which is the lowest ceiling since the Congress passed the Refugee Act in 1980. On average, before that, 96,000 were resettled every year. Only 1.6 of refugees resettled in the US since 2017 were from countries designated by the Muslim ban. On the other side of the Atlantic, you have Angela Merkel, who had pictures with Syrian refugees, had selfies. She tasted the shawarma, which is a major or a very famous Syrian dish. 584,000 Syrian refugees resettled in Germany as of 2019. And the results are very promising. More than 10,000 people who arrived to Germany as refugees since 2015 have mastered the language to enroll in a German university. More than half of those who came are in work and pay taxes. Among refugees, children and teenagers, more than 80% say they have a strong sense of belonging to their German schools and feel liked by their peers. Mental health crisis is one of the consequences of the Syrian crisis. I mentioned the violence. Syrian refugees have to deal with multiple displacement, physical injuries from displacement and fleeing, uncertainty, poor housing, poor sanitation, discrimination in countries that they fled to, difficult labor conditions, lack of stable or good schooling to their children, poor and inadequate nutrition, poor access to medical, mental and dental care, and poor access to secondary and tertiary medical care. Some of them had negative coping mechanisms like child labor, early marriage, domestic violence, drug abuse, and crimes. Also, they're facing refoulement and threat of refoulement, especially from Lebanon and other countries that wanted to push them back to Syria, even though that it's not safe to go back. And they are facing a lot of hate speech by different countries. That's why you have a high percentage of PTSD, high anxiety, and high depression among the refugees. PTSD about 30%, high anxiety about 45%, and depression about 60%. Women are more than men to have these mental health issues. Mental health crisis, of course, the armed conflict has profound impact on refugee mental health due to the exposure to violent and traumatic events, forced displacement, uncertainty, and daily stressors. We have low and inconsistent mental health resources in affected countries, cultural taboos, cultural and language barriers. There's also many of the Syrian patients present their symptoms as somatization. They complain of physical complaints, headache, abdominal pain, neck pain. Faith is important coping mechanism and source for resiliency. Studies have shown that the role of faith among Syrian refugees resettled in the US, which showed that Islamic faith is a source of comfort, strength, pride, and humility. So understanding the important role that this Islamic faith can have in providing a source of comfort and strength and empowerment for Syrian refugees is one of the components of providing better mental health for these refugees. It's interesting that there's some study that showed that Syrian refugees in urban areas have higher percentage of mental health issues than patients in camps. That's probably related to food security and shelter. The primary barriers to seeking mental health identified as feeling of helplessness, lack of financial means, poor recognition of mental health problems, the need for privacy, and the stigma. Also, many of these Syrian refugees had multiple traumatic events. This is one of study from Sweden that showed on average the Syrian refugees have been exposed to 4.2 traumatic events, including military conflict, torture, physical violence, and sexual violence. This is very hopeful. This is a recent study in Germany which showed that there is lower levels of PTSD, depression, and general anxiety disorder compared to other studies that are tracking these mental health issues in countries like Jordan, Lebanon, and Turkey, and Iraq. And the reason that this study attributed for the lower level of PTSD and depression and mental health issues in Germany is the optimized living condition and the fact that Germany has provided protection, safety, and visa status to Syrian refugees. High number of NCDs among Syrian refugees, as I mentioned. So when we deal with health issues, make sure to check for blood pressure and diabetes. These are the most common problems among Syrian refugees. In some of the studies in Jordan, about 1 out of 5 of Syrian refugees had NCDs. Hypertension, diabetes are the most prevalent. 44% have multiple comorbidities, and many of them are not able to purchase their own medications for NCDs. This is a study that was done in Germany to address the utilization of healthcare among Syrian refugees compared to matched population. And there's differences between the utilization of healthcare, and this is probably similar to the utilization of healthcare inside the United States. So in general, more Syrian refugees are using hospitals and emergency rooms, using less outpatient and dental departments. There is low prevalence of communicable diseases except for tuberculosis and hepatitis. The higher use of hospitals mostly related to increased rate or higher rate of pregnancy and perinatal services. The rate of deliveries is higher and the rate of abortion is higher. The higher hospitalization for mental health disorders. And there is less visits for mental health outpatient related to language barriers and underreporting. In general, Syrian refugees have about 10% higher expenditure on health than matched population, only 10%. And this is a graph that highlights the difference in the utilization of healthcare in Germany. And this is the last part of the presentation about the opportunities for refugee health. And this is probably very relevant to what you can do. I think there's a huge opportunities to study more the impact of the crisis in Syria on health of the Syrian refugees. It is especially an intersection of mental health, refugees, and religion, impact of mental health on physical health and usage of healthcare, improving secondary and tertiary healthcare, especially in neighboring countries like Jordan, Lebanon, and Turkey, addressing NCDs among Syrian refugees, impact of diet, exercise, and meditation, the COVID impact on camped and non-camped refugees, improving cultural competency among our healthcare providers, the factors that hinder return of the refugees, safe, voluntary, and dignified return of the refugees, empowering refugee-run organizations, especially inside Syria and the neighboring countries, training for refugee healthcare workers and licensing for them so they can provide healthcare to the Syrian refugees in the neighboring countries, refugee telehealth, integration of refugees within host communities, and improving education for children, for refugee children. I think there is a need for partnership between academic institutions and medical NGOs that are providing healthcare to the refugees, and increasing funding for domestic and global health, refugee health. And also, it's very important for all of us to speak to protect healthcare providers in conflict areas, especially in Syria. This undermines medical neutrality and Geneva Conventions that we're used to for the last 150 years. So join one of the campaigns, especially Safeguarding Healthcare or PHR, that are speaking on behalf of the healthcare providers who are suffering. There is a need for increasing resettlement of Syrian refugees in the US, refugee advocacy and collaboration, and also finally accountability for the violation against international humanitarian law and crimes against humanity in areas of conflict, whether it's Syria or Yemen or other places. Yes, the conclusion that Syria has changed the world. It created a global refugee crisis, instability in strategic region. Because most of the refugees are Muslim, that created xenophobia, Islamophobia, anti-refugee sentiment, anti-immigrant sentiment. The Syrian crisis has crossed many moral red lines and broke the international humanitarian law and norms of war. There was normalization of the usage of prohibited chemical weapons. And also it created this sentiment of anti-immigrant, anti-minorities in Europe and the United States, the rise of fascism, hate group, and populist parties and politicians. Many pundits think that the Brexit is related to the Syrian crisis and also the election of President Donald Trump. We can do what we can do as a physician. We can provide healthcare. I mean, myself, with the two physicians from Chicago, Dr. John Kaler and Dr. Sam Al-Attar, visited Aleppo that was under siege, and we provided healthcare to Syrian children and adults in underground hospitals. It was a very dangerous medical mission. We survived it. When we came back, we spoke about what's going on in Aleppo and other places in Syria. I think it's our responsibility to speak on behalf of the children of Syria who suffered a lot for the last 10 years, on behalf of the doctors in Syria and the nurses, and to let them know that we are paying attention. Please pay attention to what's going on in Syria and other conflict zones. This is an article that I wrote about how we learned from the Syrian crisis in terms of dealing with limited resources, and we applied that during the COVID pandemic in the hospitals in Chicago. We formed also MedGlobal, which is an organization to provide healthcare in disaster regions. Based on what we've learned from the Syrian crisis, we are present now in 15 different countries where we partner with local organizations to build their capacity. And finally, don't look at the numbers only. The statistics are important and the studies are important, but look at the people. Look at the victims of violence. Look at the doctors and the nurses who are suffering. Learn their stories. It's more important sometimes than talking about 500,000 or 6 million who are refugees. Mother Teresa have said, if I look at the masses, I will never act. If I look at the one, I will. Thank you very much for bearing with me. I know that this is a very long lecture. I hope that I addressed the main point that you had in mind. Feel free to contact me through Twitter or email, and good luck.